You love your pet. I mean, they're not just an animal, they're family, right?
Absolutely.
Which makes the thought of them losing their sight, maybe even going blind, just incredibly tough news to even think about.
It really is.
And what you'll learn as we get into this today is that vision loss, the kind starting at the back of the eye, it's not just one simple thing, it's actually a whole range of conditions.
That's exactly right. Today, we're doing a deep dive into retinal degeneration in dogs and cats. So we're focusing on the retina, that really critical light-sensitive tissue right at the back of the eye.
Okay.
And when that tissue starts to deteriorate, well, vision suffers, and it can potentially lead to complete blindness.
And we're tackling this pretty complex topic using that stack of sources you sent over articles, research papers, some guides written specifically for vets. Our job today really is to wade through all that info, pull out the key stuff, and just make sense of what's actually going on behind those eyes.
Yeah, and retinal degeneration is sadly a really significant cause of blindness in our pets. Now, often there's a strong genetic link, especially, in certain breeds.
Right.
But it's also crucial to understand it can be acquired, something that happens later in life because of other health problems. It's definitely got layers, but we'll break it down.
Okay, let's start right at the basics then. What exactly is retinal degeneration? Like, what's the core problem?
Fundamentally, it's the breakdown, the deterioration
Mm-hmm.
of the cells on the retina. They stop working properly.
Yeah.
And as you said, this can be because of the genes they inherited, or it can be something acquired, during their life.
Got it. And under that big umbrella term, the sources mentioned a few key types, didn't they?
Exactly. Probably the most common term you'll hear, especially for the inherited progressive kinds, is progressive retinal atrophy, PRA.
PRA, okay.
But you should really think of PRA as more of an umbrella term. It's actually a group of diseases where the retina slowly deteriorates over time.
So not just one thing called PRA?
Not really, no. The vet guides often break it down further, usually based on when it starts. You've got photoreceptor dysplasias. That's where the retina doesn't develop correctly from the get-go, showing signs really early, like before 12 weeks old.
Wow, that young.
Yeah. And then there were the photoreceptor degenerations. These start after the retina is fully formed, so the symptoms show up much later in life.
Okay, so PRA covers those slow, often genetic forms. What about when vision loss happens really fast?
Right. That brings us to SARDS, sudden acquired retinal degeneration syndrome.
SARDS.
The name pretty much says it all. It's known for vision loss that happens very, very quickly, often just over days, maybe a few weeks.
And that one's not inherited.
Correct. Unlike PRA, SARDS isn't inherited. And honestly, the exact cause, well, it's still unknown. Vets call it idiopathic. We just don't know the trigger yet.
And then there was retinal dysplasia mentioned, too. That sounds a bit different again.
It is, yeah. Retinal dysplasia isn't really degeneration like PRA, where cells break down after developing. It's about abnormal development of the retina, right from birth.
Okay, so it's there from the start.
Exactly. It gets talked about alongside PRA because the signs, what the owner sees, can sometimes look similar. And depending on how severe that malformation is, it can range from just little folds in the retina that don't really affect vision much, all the way to really severe problems like retinal detachment and blindness.
So we've got inherited PRA, sudden SARDS, developmental dysplasia. What about the retina breaking down because something else is wrong?
Ah, yes, that's a super important category. Secondary retinal degeneration.
Secondary, okay.
Yeah. Here, the retinal problem is a consequence, a result of other issues. Could be something else in the eye or even a body-wide problem.
Like what kind of things?
Well, the sources list quite a few. Things like chronic high pressure inside the eye from glaucoma, a detached retina, inflammation inside the eye, chorioretinitis is the term.
Okay.
Systemic hypertension, so high blood pressure, that's actually a really common cause of sudden blindness and retinal damage, especially in cats.
Really? High blood pressure?
Absolutely. And historically, certain nutritional deficiencies were a factor. Taurine deficiency in cats was a big one, though the sources do stress that's much rarer now thanks to good commercial diets.
Right, that makes sense. So that covers the what, a lot of different ways the retina can fail. Let's shift to the why. You mentioned genetics are a big factor for PRA.
Yeah, and this is where the research gets really, really interesting. The sources make it clear. For inherited PRA, it's not just one single genetic flaw, it's many.
Okay.
Scientists have actually pinpointed a number of specific genetic defects. These mutations basically mess with how the photoreceptor cells, those rods and cones that detect light, develop, or how they function, or how they're maintained.
And the way these faulty genes get passed down isn't always the same either?
No, the inheritance patterns differ. Most forms of PRA are autosomal recessive.
Okay, what does that mean exactly?
It means a pet has to inherit one copy of the faulty gene from each parent to actually get the disease.
Okay. One copy, you're okay.
Usually, yeah. One copy typically makes them a carrier. They don't show signs but can pass the gene on. Then you have less common forms that are autosomal dominant. Only need one copy of the bad gene for that one, seen in some mastiffs, for example.
Right.
And even rarer are X-linked forms, carried on the X chromosome. Those tend to affect males more often. Siberian Huskies, Samoyeds, those breeds have known X-linked PRA.
Mm.
The sources even get down to specific gene names, like PRCD, RCD1, CEP290. Each one causes a slightly different type or timing of the degeneration.
So it really comes down to figuring out which specific gene pathway is broken in that animal or breed.
Exactly. And even within those inherited forms, the sources differentiate a bit. You have rod cone degenerations. That's where the rods, which handle night vision, go first. Then the cones for day vision follow. That's the most common PRA pattern.
Rods first, then cones.
Right. But then there are less common types like cone rod or even cone-only degenerations, where day vision is hit hardest and often earliest.
Okay, so genetics explains a lot of the why for PRA. But you stressed it's not always genetic. What are these other causes, the acquired ones?
Absolute crucial point. Many cases are secondary. The sources list a whole range of things. Problems with the layers supporting the retina, like the retinal pigment epithelium or the choroid. Rare metabolic diseases, like certain storage diseases where the body can't process stuff properly and it builds up and damages the retina, sometimes the brain too.
Wow.
Inflammation or scarring left over from infections or injuries, exposure to certain toxins. The guides give examples like rare reactions to specific drugs, interfloxacin in cats is one sometimes mentioned, or griselfulvin, damage from really intense light, maybe during surgery, or even radiation therapy if it's near the eye.
Okay.
Nutritional problems definitely play a role, or at least they did historically. Vitamin E or A, deficiency in dogs, and as we said, taurine in cats, though, again, commercial diets have mostly solved that. A previous retinal detachment can cause degeneration later, same with long-term glaucoma.
And you mentioned central PRA earlier, something about vitamin E.
Yeah, central PRA often gets discussed separately. The pattern of vision loss is different, hits the central vision first. The sources suggest it might be linked to a specific genetic issue with how the body uses vitamin E, or it could just be acquired through a straightforward vitamin E deficiency.
Interesting. And SARDS, you said the cause is unknown, but any clues?
Still technically idiopathic, yeah.
Yeah.
But the research is leaning towards potential immune system involvement. Maybe it attacks the retina, or possibly something related to hormones, neuroendocrine factors, but the exact trigger, still elusive.
Okay, so a complex web of causes. Who tends to get these conditions? Are there specific breeds, ages?
Definitely patterns there. Both dogs and cats get retinal degeneration, but the inherited kinds are significantly more common in dogs than cats.
Oh, I'm dogs, okay.
Age of onset is a big clue. Varies hugely with the type. Early PRA, or those dysplasias, signs can pop up anywhere from, say, 3-4 months old up to maybe 2 years. Late onset PRA, that typically shows up when they're older, maybe over 4 to 6 years. Cone degeneration, often very early, 3-4 months again. And SARDS, even though it's sudden, it usually hits middle-aged to older pets.
Any difference between males and females?
Yes, a couple of points. Those X-linked PRAs we talked about, like in Huskies and Samoyeds, more common in males because of how X-linked inheritance works.
Makes sense.
But interestingly, with SARDS, there's a really strong bias towards females. Something like 70% of SARDS cases are in female dogs.
Wow, 70%. That's significant.
It really is.
The sources you shared had these huge lists of breeds. Can you give us some highlights, like key breeds for different types?
Sure, yeah. For inherited dysplasia, you think of breeds like Bellington Terriers, English Springer Spaniels, Labs, Cavalier King Charles Spaniels, Collies. Collie eye anomaly is a well-known example there.
Okay.
Early onset PRA, really prominent in Irish setters, Cardigan Welsh Corgis. Late onset PRA, gosh, tons of breeds. Poodles, Cockers, Labs again, Dachshunds, Akitas, Samoyeds, Huskies.
Lots of popular breeds.
Very much so. Central PRA is noted more in Labs, Goldens, Border Collies. Cone degeneration is strongly linked to German short-haired pointers. Even some of those rare neurological storage diseases that affect the retina, like neuronal ceroid lipofuscinosis, or NCL, they're tied to specific breeds like English setters and Border Collies.
And SARDS, which breeds pop up there?
For SARDS, common ones are Brittany Spaniels, miniature Schnauzers, Dachshunds again. But importantly, SARDS is also really common in mixed breed dogs. It's not just a purebred issue.
Good to know. What about cats?
In cats, Abyssinians and Somalis are known for specific inherited types, mutations called RDAC and RARD. Persians and Siamese are also mentioned. And sometimes you see links, like skeletal problems alongside PRA and Samoyeds, or multiple eye issues together in Akitas. So yeah, breed is definitely a big clue.
That really helps paint a picture of who's at risk. Now let's switch perspective. For you, the owner, what signs would you actually see at home that might make you worry about retinal degeneration?
Okay, for the most common types, the PRAs, the very first thing owners usually pick up on is trouble seeing in low light, nyctalopia, night blindness.
Night blindness.
Yeah. You might notice your dog seems hesitant to go outside when it gets dark, or they start bumping into furniture in rooms that aren't brightly lit. Maybe they don't want to go into dark hallways or rooms anymore.
Okay, subtle things at first.
Can be, yeah. And it gets progressively worse over months or years. Eventually, it starts affecting their vision in bright light too, leading towards total blindness. Although sometimes it might seem like the blindness happens suddenly, especially if they're put in an unfamiliar place once their vision is really poor.
Right.
And remember, the age link, those dysplasias or early PRAs, you'll see these signs when they're very young. They'd be totally blind by age 2. Late onset PRA, the signs appear when they're older dogs. Cone degeneration, which is pretty rare, is almost the opposite problem. You'd see puppies, maybe 8 to 12 weeks old, who seem really bothered by bright light. That's photophobia. They struggle to see and get around during the day, but their night vision stays okay for longer. Central PRA, also rare, mainly affects central vision, so they might not go completely blind.
And SARDS, the sudden one, how does that present to an owner?
Yeah, SARDS. The hallmark is rapid vision loss. Like over a week or two, maybe up to 4 weeks max. Owners often report their pets seem fine one day and then suddenly they're crashing into things, obviously can't see.
Just like that.
Pretty much. But here's the really distinctive part, as the sources point out, and it often helps vets clue in. Pets with SARDS very often have other signs too. Systemic signs.
Like what?
Owners might notice they're suddenly drinking tons more water, needing to urinate way more often, and they have a ravenous appetite. Often, they gain weight too.
Wait, so sudden blindness plus increased thirst, urination, appetite?
Exactly. And those signs, the PPD polyphagia, as vets call it, can look very much like a hormonal condition called Cushing's disease or hyperadrenocorticism.
Wow. Okay, that combination is a huge red flag then. That's really critical for owners to know. Now, what about what the vet sees during an exam? What are they looking for?
Well, during a careful eye exam, especially if the degeneration is more advanced, the vet might see the pupils are really wide, dilated, especially when they shine a bright light. And the pupillary light reflexes, you know, how the pupil should shrink quickly with light. They might be sluggish or almost absent.
Okay.
Then, looking into the back of the eye with an ophthalmoscope, they'll look at the tapetum. That's the shiny reflective layer that causes eye shine. Because the retina overlying it is getting thin, the putatum looks hyperreflective, like abnormally bright and shiny. The areas without tapetum might lose pigment or look mottled. The little blood vessels crisscrossing the retina often become very thin and narrow, sometimes described as looking like silver wires. And the optic nerve head, where signals leave the eye, that might look pale, atrophied. Any other signs?
Yeah, specifically with PRA, it's really common to see secondary cataracts forming, usually starting at the back of the lens. And the vitreous, the gel inside the eye, can also degenerate.
And for SARDS, what might the vet notice on exam?
With SARDS, apart from the blindness, the vet might note if the animal seems overweight, and again, those slow or absent pupil responses. The vet guides mention a specific test called chromatic PLR testing, using red and blue lights separately.
Chromatic PLR, yeah. Early in SARDS, it can sometimes show a reduced pupil response to red light, which mainly stimulates the rods, but a more normal response to blue light, which hits cones. That specific pattern can be a strong clue pointing towards SARDS, even before the back of the eye looks really bad. And the sources mention other specific looks too, like borazoid chorioretinopathy has these multiple little spots. Taurine deficiency in cats is a very classic pattern, starting as a lesion near the center and spreading into a horizontal band before becoming widespread. Old inflammatory scars will also look different, maybe focal areas of brightness or pigment changes. And of course, signs from underlying systemic diseases like cloudy corneas or neurological issues with storage diseases.
So it really takes that careful look from the owner noticing changes, plus a vet's detailed exam. How do they actually confirm the diagnosis and figure out which specific type it is?
It definitely starts with that thorough eye exam we discussed, testing vision responses, like the Menace test or watching them track a cotton ball, and that detailed look at the fundus, the back of the eye. Checking those pupil responses is key too.
But you said sometimes the back of the eye looks normal at first, especially with SARDS. Or the view might be blocked by a cataract.
Exactly. And that's where the real gold standard diagnostic test comes in.
Yeah.
The electroretinogram, the ERG.
Okay, ERG. How does that work? What is it measuring?
Think of it like an EKG for the heart, but it's measuring the electrical signals produced by the retina itself when it's stimulated by flashes of light.
Ah, okay. Electrical activity.
Precisely. And it's considered the gold standard because it definitively tells you if the problem lies within the retina.
Yeah.
If the ERG is abnormal, the retina is not working right. If the pet is blind, but the ERG is normal, then the problem must be further back optic nerve or brain.
Got it.
It's super sensitive, too. It can detect problems even before you can see physical changes in the eye, and sometimes it can even identify carriers of inherited PRA who don't have symptoms themselves.
So what does the ERG show in these different conditions, like SARDS versus PRA?
Yeah, this is crucial for diagnosis. For SARDS, the classic ERG finding is that it's extinguished, flatlined. Basically, no detectable electrical activity from the retina at all, even if the fundus exam looks relatively normal early on.
Wow, completely flat.
Yeah. Whereas for inherited PRA, the ERG typically shows reduced electrical responses from both the rods and the cones. Often, the rod responses are affected more severely or earlier on, matching that night blindness owners see first.
Okay, so the ERG confirms the retina is the issue. How do you pinpoint if it's one of the inherited types?
That's where genetic testing comes in. These tests are designed to look for the specific gene mutations that are known to cause inherited PRA in particular breeds.
And how useful is that, practically speaking?
Though incredibly useful. For one, it gives a definitive diagnosis for an affected pet. Yup, they have the gene for this type of PRA. For breeders, it's absolutely critical because it can identify carriers, those animals that seem healthy, but carry one copy of the faulty gene and could pass it on.
Right, so they shouldn't be bred.
Exactly. And you can even do pre-symptomatic testing on puppies from at-risk breeds to know if they're going to develop PRA long before they show any signs. The sources mention specific labs like Optogen, VetGen that offer these panels.
Okay. And what about ruling out all those secondary causes we talked about earlier? What other tests are needed?
Good point. You definitely need to look for underlying problems. Usually, a vet will start with baseline blood work, a CBC and chemistry panel, and a urinalysis.
Standard stuff.
Yeah. Often these are actually normal and straightforward PRA. But in SARDS cases, the blood work might show changes hinting at that Cushing's-like state, maybe elevated liver enzymes or cholesterol.
Ah, linking back to those systemic signs.
Right. So a specific SARDS workup might involve more tests, maybe a CTH stimulation test for Cushing's, checking sex hormone levels, and definitely checking blood pressure. That's super important, especially in cats presenting with sudden blindness, to rule out hypertensive retinopathy. They'll also check for protein in the urine. And if, say, taurine deficiency is suspected in a cat on a weird diet, you can test taurine levels in the blood. For those really rare metabolic diseases, there might be specific enzyme tests. Imaging can play a role too, maybe an ultrasound of the eye if a dense cataract is blocking the view, just to check if the retina is detached behind it. Or if the blindness seems like it might be coming from the brain or optic nerve, then advanced imaging like CT or MRI might be recommended.
So it can be quite a diagnostic journey, putting all the pieces together. Once you have that diagnosis, what can actually be done? What are the treatment options?
Yeah, this is often the most difficult part of the conversation for vets and owners. Because for most inherited retinal degenerations, like the common forms of PRA, and also for SARDS, the sources are very clear. There is currently no cure.
No cure.
No cure that reverses the damage or stops the progression, unfortunately. The process is typically irreversible.
That's really tough news. So what does the focus become then?
It shifts entirely to adaptation and support. And here's the really key message from all the sources for you, the owner. Most blind pets, particularly dogs, adapt amazingly well to losing their vision, as long as they're in a stable, familiar environment they know.
Okay, so adaptation is possible, even likely. How can owners help their pet adjust?
The sources give some great practical tips. Keep furniture, food bowls, water bowls, beds, all that stuff in the same consistent places.
Yeah.
Don't suddenly rearrange the house.
Right. Keep the map the same.
Exactly. Use your voice, lots of verbal cues. Use scent markers sometimes. Always supervise them when they're outside. A securely fenced yard is ideal, and make sure there are no hazards they could fall into, like uncovered swimming pools.
Good point.
Toys that make noise can help them still play and locate things. The guides are quite firm that blind cats really should be kept strictly indoors for safety.
Indoors only for cats. Okay.
Now, they do mention that some pets might struggle more with adaptation. Maybe older pets who also have hearing loss, or some cognitive decline, some senility starting. And while it's not guaranteed, some behavioral changes like increased anxiety or maybe being less active are possible. But it's also worth remembering, if a pet loses sight in only one eye, they usually function completely normally. Now, for those secondary types of retinal degeneration, management is all about treating the underlying cause, if possible.
Okay, so if you find the cause, you treat that.
Right. Like if a cat is diagnosed with taurine deficiency, which, again, is rare now, but possible giving taurine supplements is critical. That's one of the few situations where treatment can actually stop the retinal degeneration from getting worse, though usually any vision already lost doesn't come back.
But it can halt it.
It can halt further progression, yes.
Uh-huh.
For dogs, it's mostly about ensuring a balanced diet. Some sources mention maybe avoiding diets super high in polyunsaturated fats if vitamin E is a concern. Antioxidants like vitamin E, vitamin C, lutein, omega-3s. You'll sometimes hear vets recommend these for general retinal health.
Do they help with PRA?
Well, the sources generally say there isn't strong scientific evidence that these supplements can actually stop or reverse inherited PRA. They might potentially help slow down the development of secondary cataracts, but the jury's still out on significant benefit for the PRA itself.
Okay. And speaking of cataracts, they're common with PRA, right? Can cataract surgery help?
Yeah, that's a frequent question. And the answer is maybe, but with a huge if. Cataract surgery can restore vision, but only if the retina behind that cloudy lens is still working.
Ah, so the retina has to be functional.
Absolutely.
Yeah.
It is essential, critical, that an ERG is done before even considering cataract surgery on a pet that has PRA or SARDS. If that ERG shows the retina is already badly degenerated, severely damaged, then removing the cataract won't help them see. There's nothing back there to process the light.
Got it. ERG first is crucial. What about treating things like high blood pressure in cats?
Yes, if hypertensive retinopathy is diagnosed, then getting that high blood pressure under control aggressively is vital. If it's caught early enough, managing the hypertension can prevent more damage to the retina and maybe preserve whatever vision is left. But again, damage that's already happened is usually permanent. Same goes for treating underlying inflammation or other causes if they can be identified.
So it sounds like for most of these conditions, there isn't really a medication that stops the retina itself from degenerating.
For the vast majority, that's correct, based on the sources we have. There aren't generally effective drugs listed that halt or reverse most common forms of retinal degeneration like PRA or SARDS. You might treat specific rare metabolic things, like pyridoxine for ornithine deficiency, but not the main conditions.
Which really underscores the importance of prevention, especially for the inherited types.
Absolutely vital. This is where responsible breeding practices and genetic testing make such a difference. The message from the veterinary guides is crystal clear. Animals that are diagnosed with inherited PRA or identified as carriers via genetic tests should not be used for breeding, period. Screening programs are the key to reducing how often these diseases occur down the line.
Okay, so putting it all together, what's the overall outlook? The prognosis?
For inherited PRA, the prognosis is eventual, irreversible blindness. That's the reality. However, because it's usually slow, most pets adapt incredibly well, especially in their home environment. It's not a painful condition, and they absolutely can maintain an excellent quality of life with supportive care from their owners.
That's reassuring. And for SARDS?
For SARDS, the prognosis is sudden, acute, and also irreversible blindness. But again, the experience is that most animals adapt well over time with owner support. Retinal dysplasia. The prognosis really varies depending on how severe it is. Mild forms might cause no issues. Severe forms mean blindness from birth.
And the secondary ones?
Depends entirely on the underlying cause and how much damage was done before it was caught. Treating the cause, like getting blood pressure down or giving taurine, can sometimes stop it getting worse, maybe save some vision if caught very early, but often significant vision loss is permanent by the time of diagnosis.
So it's definitely challenging, but it sounds like many pets can still lead happy, fulfilling lives despite the vision loss. Are there Any sort of glimmers of hope? Exciting research mentioned in the sources for future treatments?
Yes, definitely. The research field is quite active. Gene therapy is highlighted as a really promising area. There have been clinical trials, especially in certain dog breeds with known genetic defects, that have shown some positive results. It's complex, but there's potential there.
Gene therapy, wow. Anything else?
Researchers are also looking into stem cell therapy, trying to replace damaged cells, and developing new drugs, pharmacological approaches that might slow down the degeneration or protect the remaining cells. So, yes, there are exciting possibilities being explored for the future.
That does offer some hope down the road. Okay, so wrapping up this deep dive then. We've really seen that retinal degeneration in our dogs and cats isn't just one thing. It's this complex group-inherited conditions like PRA, the sudden shock of SARDS, developmental problems like dysplasia, and then forms that happen because of other health issues.
Mm-hmm.
Figuring it out often takes a mix of a good exam, specialized tests like that ERG, and sometimes genetic testing for the inherited types.
That's right.
And while cures are, well, limited for most forms right now, the main focus becomes helping the pet adapt, managing any underlying issues if possible. And crucially, as you said, with the right support, most pets can adapt incredibly well and continue to live full, happy lives even without their sight.
Absolutely. They really can.
Which kind of leaves us with a final thought for you to mull over. Thinking about how incredibly resilient and adaptable dogs and cats often are when they lose their vision, especially when they have that love and support in a familiar environment. What does that teach us, really, about resilience, about overcoming challenges, and maybe how can that understanding influence how we approach other difficulties, both for our amazing pets and maybe even for ourselves?